So let's start with the respiratory tract infections related discussion, right? A very common and very prevalent problem in winter season, and very easy to understand how a person succumb to different respiratory tract infection, how you can differentiate between these different infections, and what kind of treatment modalities would you offer to the cases with respiratory tract infections. When a bug enter inside the human beings and is supposed to cause respiratory tract infection, what will be the entry route? The entry route gonna be nasal cavities. So through these nasal cavities, the organism gonna move inside. Now what it can lead to? Either it will go above carina or it will go below carina. So if it go above carina, there are 6 structures basically which will get infected, and these 6 structures are which will get affected. These 6 structures are 1 pharynx, 2 larynx, 3 epiglottis, 4 trachea, 5th tonsil, and 6th sinuses. So above the carina, carina is the bifurcation point of trachea. At the level of carina, trachea divides into halves, right bronchus and left bronchus. So above that, these 6 structures will get affected secondary to any bug which enter inside from the nasal cavities inside your body. And below that, below carina, either it will lead to the bronchi are present and the lung parenchyma is present. So if these total, we consider these total 8 structures and we consider their infection, we call it as below the carina bronchitis, acute bronchitis, and same way community acquired pneumonia. So the 2 things will happen if the bug result in some infection of either bronchi or major lung parenchyma. And if it goes high, then it will lead to laryngitis, epiglottitis, tracheitis, pharyngitis, tonsillitis, and sinusitis. So it's easy to understand these things. Now different clinical picture and different clinical scenarios will help you, will guide you to reach to conclusion what sort of problem a person is having. Like you encounter a person, I would be offering clinical scenarios and you can easily pick. You encounter a person, a 20-year-old boy comes to you at your clinic with complaint of difficulty in swallowing, throat irritation, and dry cough. When you check his temperature, it's around 101 degree Fahrenheit. The answer is acute pharyngitis. The same boy complains that after 3 days of optimal medical therapy, he did not respond, and now fever has gone to 103, 104. It's accompanied with rigors and chills. He is finding it difficult to swallow things, and when he places his hand over the lower jaw, he is finding some kind of nodule, mass or lump, and it's tender as well. Now this has turned to acute tonsillitis. Now the same boy complains that I was having these symptoms, and beside these symptoms I had some flu-like symptoms as well. But now from the last few days I am having headache, and as I bend my head down I feel worsening of pain. As I place my hands over that area of malar prominences, I feel pain. Maybe the right one, maybe the left one. The answer is then sinusitis. And a person then develops kind of barking cough, a whoop-like cough. Then the problem is likely epiglottitis. And the remaining one, tracheitis, is simple throat irritation. In the setting of tracheitis, there will be throat irritation, but there won't be difficulty in swallowing because it's not pharynx now, it's trachea. So in the patients with tracheitis, they would be having dry cough, but there won't be any problem. Throat irritation can be there, but they won't be having problem with the swallowing. And then the last scenario, the voice of that person turns hoarse. When he speak like, I am having bad throat. So if he speaks like that, that suggests that he has developed laryngitis. In simple language, आप कहते हैं गला बैठ गया एक बंदे का. So it's so easy to understand. You just keep on asking questions from different patients, and by asking those questions, you can reach to conclusion what sort of problem a person is having. The cough in the setting of the problems, infections, above the carina is nearly almost always dry, until unless a person is having post-nasal drip because of the inflammation of the nasal mucosa, throat mucosa, that can lead to production of that mucoid secretions, and the patient can cough out those things. That happens occasionally. Well, now the things go down. The same infection, and remember, it's mostly the same infection which keeps on involving different parts. Some person develop pharyngitis complicated with tracheitis complicated with laryngitis. Somebody developed that pharyngitis lately complicated with sinusitis. Somebody developed that pharyngitis lately complicated with tonsillitis. Means these different infections, because the mucosa is in continuum. There are no major breaks in between. So one problem can affect the other contiguous structure, other attached structure. Right? So now the things are going down. The things are going down, and below in the lungs, when this infection spread, that lead to what? A person, the same person say claims that now I am having fever which is around 100, 101, and besides that fever I am having cough with sputum. That sputum is greenish color, on occasions it's yellowish color. The fever is not that high grade, it's intermediate grade. So the answer is, he is suffering from acute bronchitis. He is suffering from acute bronchitis. The same person complains now that I am having high grade fever with rigors and chills. The temperature is touching 103, 104. He complains that whenever I am having cough or deep inspiration, I feel intense pain in my right lower chest. High grade fever with rigors and chills. Cough expectoration may be accompanied with chest pain at a certain point, at a certain area, which worsens with deep inspiration and coughing. You label such person as having pneumonia. So these are all clinical diagnosis, and then you will confirm these things with labs. So in winter, you are going to encounter so many patients coming with these problems. You should have proper approach towards these conditions. Thank you.